Today, I will be talking to you about physician-assisted suicide and why it should be legalized. Some of you may be wondering what physician-assisted suicide is. Physician-assisted suicide is when a terminally ill patient has attempted all other options and all of them have sadly failed, leaving them with the option of their physician essentially hastening their death. The patient must be in urgent need of a solution to their pain and suffering. According to the article State-by-State Guide to Physician-Assisted Suicide on procon.org, 4 states have already legalized physician-assisted suicide: Vermont, Oregon, Washington, and Montana. Imagine you're going in for a simple routine checkup. Your doctor comes back into the room explaining to you that they have found cancerous blood cells. You have stage 4 cancer and practically no chance in making it past 7 months. Chemotherapy will most likely do nothing besides cause more pain, which would leave you with nothing else but pain and suffering, which would be the same thing as if you would do nothing at all. Chemotherapy would technically make you more sick while you're dying anyway. What options do you have, and what would you do? This is where physician-assisted suicide would come in. Pain and anxiety have set in, taking away the value in your life. Physician-assisted suicide would eliminate the pain and suffering and the anxiety within the patient and their family. For their further care and comfort would be gone. Also, self-inflicted suicide would be eliminated. According to Tracy E. Miller, a physician, the 2 most common reasons people commit suicide are depression and pain. We euthanize our animals when they are terminally ill or in great pain, and it is considered inhumane to prolong their suffering. How come we have not decided that it is cruel and inhumane to prolong suffering in our own people? We let our people lay in their bed, they can't get up, they can't go out and enjoy the rest of their life with their family. Because when you have a terminal illness, it's not like up to that last day you can still be walking around, having fun, talking to the people you love, still being able to even communicate at all. Nevertheless, you're just practically laying in a bed wasting away with nothing left to life besides basically your body. The decision for physician-assisted suicide would be 100% up to the patient. The physician would have no say in it, so this would eliminate any possibility of having a careless or, not careless, but a physician that didn't really have the time or the patience to take care of you because you're so sick. The patient would be only given this option after every other option has been attempted and has failed. This means the physician would have to attempt everything else with the patient, the different medications, different surgeries, anything that they could do to possibly make them more comfortable and nevertheless maybe better, but it would only be an option if all of these failed. The decision would also be private and personal. No one else would have say in the person's decision. They would be left alone to make this decision 100% themselves with no one interrupting them or anything. You may know a family member or a close friend who has been diagnosed with and is suffering through a terminally ill sickness. You may know someone and you may have watched a loved one pass away through great pain and suffering. You alone may be going through a terminally ill sickness or may be diagnosed someday with a terminally ill sickness, and you may be left with no other option than to lay there in pain and suffer until the day where you pass away. This is why physician-assisted suicide should be legalized, to give you that option when there is nothing else left to do. Vote to legalize physician-assisted suicide.